Senate Democrats today told President Obama to slow down on his health care reform plan.
There are still a lot of questions over what form the plan will take. Congressman Peter Roskam joins us now from Washington to talk about health care reform. Congressman, thank you so much for being here.
Thank you. Go ahead, Rob.
Do you consider it a victory for the Republicans and the opposition to the president's health care plans that it is at least postponed now until after the recess?
Well, I think most Americans are really interested in learning more about what this plan is. And I think what the president ran into was members of his own party that came to him and said, look, you're moving this thing too fast. You moved a 1,000-page stimulus package in a very short period of time, and that has underperformed. Moved through a very aggressive cap and tax program, a large energy tax. That got people's attention, and now it's Democrats, by and large, that have gone to the president and said, slow this down, Mr. President. If it's a good idea today, it's going to be a good idea after the congressional recess. Let's let Americans look at this plan, and let's have a good conversation about it.
Do you think Republicans are being included in the conversation?
Well, I think there's a little bit of both. There's sort of lip service to having an interest in a conversation, and I think the White House has reached out a little bit. But I think the weakness of their approach is the amount of money that they plan on outlaying. I was in the Ways and Means Committee last week when the Congressional Budget Office director came in and said two things, and I'm paraphrasing, but his first point was, you're rushing this. We haven't had a chance to evaluate it. But he said the second thing is, you say, Mr. President, that this will save money. In fact, there's no indications it's going to save money. This is going to cost billions of dollars. Those types of threshold questions have to be answered before the country can, I think, even absorb this debate.
Well, is there a place to compromise, and are the Republicans willing to look for compromises? It has been criticized by the Obama administration that the idea has been just to politicize it and kill it, that that we'll break him over this. If he doesn't win this, then we've got him.
I think that there's a lot of common ground. I think that there is a real interest on the part of most Americans to try and come up with a health care system that creates more access for more folks that aren't served by the current system and also controls costs. But ultimately, what can't be a part of this deal, as far as I'm concerned, and what I'm hearing from constituents in the west and northwest suburbs, is that they don't want this government-run health insurance plan. They think that it's going to undermine the private health marketplace and that it's ultimately a prelude to a single-payer system. That, I think, has to be off the table. If that's off the table, then let's come back and really talk about the common ground.
All right. Thank you very much, Congressman Roskam, for joining us tonight.